lost plane tickets, like you're wanting to run away. I keep holding my tongue, can't find the words to say. If I asked you to come back, would you plant yourself for a while? Would you look me in the eyes before you turned around? Please don't go, please don't go, don't fly away. Please don't go, please don't go, don't fly away. Started rolling, never got our feet off the ground. We got stuck, no way up, no way down. Now I made up my mind, I'm not gonna lie to you again. I'm gonna tell you what I want, I'm gonna let you in. Please don't go, please don't go, don't fly away. Please don't go, please don't go, don't fly away. Don't fly away.
Let's take a better look beyond a storybook and look to stone. Let's go to sleep with clearer heads and hearts too big to fit our beds. And maybe we won't feel so alone before we turn to stone.
Good morning. Thank you all for being here. We're so excited to see such a great crowd. We're right at 11 o'clock, and so we're going to get started here in just a few minutes. So if you guys want to come on in and find a seat, we may not have enough chairs for everyone. We're so excited we have such a great crowd here today. Please make yourselves comfortable wherever you can find a seat. There's standing room around the edges of the room, and we're going to get started here in just a few minutes. Thanks.
I know that I am nothing new. There's so much more than me and you. But brother, how we must atone before we turn to stone. Before we turn to stone.
shelter or show me heart. Come on, love. Come on, love. Watch me fall apart. Watch me fall apart. And I'll be yours to keep. Wind in the shadow, well song in the deep. Wind in the shadow, well song in the deep. Darling, you with me, always around me. Only love, only love, darling. Only love, only love. Give me shelter, oh show me heart. Come on, love, come on, love. Watch me fall apart, watch me fall apart. And I'll be yours to keep. Wind in the shadows, well song in the deep. Wind in the shadows, well song. Darling, you with me, always around me. Only love, only love. Darling, I feel you under my body. Only love, only love. Give me shelter, show me heart. Come on, love, come on, love. Watch me fall apart.
Well, good morning, everybody, and welcome. It's so great to see all of you here. It's a beautiful Upper East Tennessee, Southwest Virginia day, and today's a special day for the region, special day for a lot of people. As I look out here tonight, I see a young man there, Hudson. You think about the things that we're going to try to do. It's about him, and it's about his generation and the generations that are going to come. And a lot of people worked really hard over the last 4 years to get us to this day. I'm going to recognize them in a moment, but before we do that, I'd like to share with you a quick video.
Hold on to me as we go.
I am a certified child life specialist.
I do set-up consultations for the doctors.
I'm an internal medicine doctor.
My job is working in housekeeping.
I've been volunteering for 16 years.
Just know you're not alone, 'cause I'm gonna make this place your home.
I want them to feel safe.
Welcome.
Comfortable. We're all family.
More likely, it's a home away from home.
Because I enjoy my work. I enjoy cleaning. I enjoy being around people.
I do. I love my job.
It's a joy, and it's just rewarding. It is very rewarding.
I think the work chose me.
It is so humbling to me that I'm able to be a part of their story here. The biggest part of my job is learning about my patient's story.
You make the time and you take the time.
Well, you just listen, and
It means so much to see their face light up and have them at the end say, I did it.
I'm gonna make this place your home.
I love listening to their stories.
Ballad Health. It's your story. We're listening.
Well, ladies and gentlemen, Ballad Health. Ballad Health isn't a bunch of buildings with bricks and mortar, it's people. And some of those people are here today, and I'd like you guys to stand up and be recognized. The people that were in those videos. Stand up for a moment, just let us recognize you. You guys are heroes. I'm going to speak for just a few minutes, so hope you all brought pillows. On behalf of the Ballad Health Board of Directors, I want to welcome all of you and thank you for joining us to celebrate an important milestone for our health system and for our entire region. By Wednesday, January 31st at midnight, the boards of directors of Mountain States Health Alliance, Wellmont Health System, and Ballad Health unanimously approved the final resolutions necessary for us to close on the merger and to create Ballad Health. All the necessary documents were filed timely, and through a lot of work at the Department of Health, the Attorney General's office, and in our legal counsel's offices, it all got done. So as of yesterday, Ballad Health was born. Today, we celebrate the commencement of something new, but we should remember how we got here. This is a challenging time for hospitals and health systems. The consolidation wave affecting hospitals all over the country continues. As recently as last month, 3 huge major mergers were announced that are going to create huge national health systems, and I know David Lester is going to talk about that in a moment. And rural hospitals continue to close, with Tennessee being second among the states with the number of rural hospitals that have closed. Proverbs 29:18 says that where there is no vision, the people perish. Simply put, 4 years ago, our leadership saw what was coming. They saw rural hospitals closing. They saw an opioid epidemic establishing its roots in our region. We saw the need for services people wanted and that we wanted to provide, but we couldn't because culturally, our systems were too busy beating each other over the head to make the proper investments in the things that will ultimately make our community healthier and more competitive as a region. In short, the management teams and the boards had a vision. That vision was refocusing resources where we could provide less duplicative but more focused services based on the needs of the population and not just simply each system's financial needs. It included taking meaningful steps to increase access to services for our children. It meant taking some risk and investing in addiction treatment and expanded mental health. It means partnering with academic institutions to expand research opportunities and maintain a robust pipeline of new physician and allied health talent for the region. And it means becoming known as a high-quality, top-performing health system and not being afraid to set that goal. It means recognizing there's too much duplicative and avoidable cost. But it also means stepping back and realizing it's not just bricks and mortar and more buildings and more structures that create a great health system. It is the people inside those buildings and in the community that make it matter. People like Danny Dingus. I had a chance to meet Danny yesterday. I was touring Holston Valley Medical Center with Tim Atterbury. Tim, thank you for that. And I was walking down the hall. Now, Danny he's been there for 47 years at Holston Valley. He's a nurse educator in the ICU. And as I was walking down the hall with Tim and Eric and Deaton and Danny pulled me into his office, and he wanted to show me a sign that he had made himself the day that we announced Ballad Health. It was a little handmade sign. The sign was a little dusty. This has taken a pretty good time. But it said, Ballad Health, yes, with an exclamation point. People like Danny, who've lived here for so long and who go to work every day doing their passion, they don't care about the politics and which system wins on any given day. They care about the people they're trusted to serve, and that's why they're on board, and that's why they've been on board with this from the beginning. It's also about people like the ones I just introduced to you, who shared their stories, who shared their individual stories on some video, and we shared their stories on social media this week, and I hope you had a chance to see them. But I'd like for you to listen to a little bit. Am I going to, Teresa? We're going to do another quick video. That was okay. So I rewrote the script, you know. I'm known to do that from time to time. Let me ask you, if there are any other Ballad Health team members here, can you all stand up? Let's recognize them. Now, let me tell you a little bit of the story about the name and the culture. Our name is Ballad Health, and as you can see, our tagline is, "It's your story, we're listening." That was not an accident. Every day, we have the privilege of having a front row seat to the story of our patients' lives. I can't think of a bigger privilege than that. They bring themselves to us at their most vulnerable moments, and they trust us. And in considering our name, when we asked them what was important to them, they said the same thing over and over again. I want you to listen to me. And that became our name and our tagline, and it will be our culture. Whether it's being with patients and families or dealing with each other, we all can be better by listening. And so that's why our tagline is a daily reminder of the privilege we have of hearing people's stories, and by listening, learning how we can help. It's not just our patients, as I said, but each other and the hundreds of interactions we have every day. We think we can make our region and community better if we would just simply listen. Again, I like to quote a little bit of scripture here. Proverbs 18:13 says, "If one gives an answer before he hears, it is his folly and his shame." We have an obligation to listen to our patients and their families, hear their story, and then help them figure out where they need to go to help them. And that is going to be the culture. And we're going to work to make it so. I remember sitting in a golf cart in early 2014 with my friend Bill Green. Now, everybody knows Bill is a mild-mannered, laid-back guy that doesn't like to interfere much in things. But he and I were sitting there talking about the fact that Wellmont was possibly up for sale. And he asked me what I thought the future would look like for our region's hospitals if that cascade of events were to have occurred. And I shared with him what I thought those challenges were. I told him the Board of Mountain States had decided to propose a merger with Wellmont. He stopped the golf cart and he sat quietly for a moment, and he said, "That is exactly what you need to do." We didn't talk much more about it after that, but the next thing I knew, I was invited to a meeting at his house with business leaders from all over the region. They asked me a bunch of questions. I answered them honestly. And then a movement began unlike anything I'd ever seen. It took on a life of its own. There were a lot of people that got involved in this merger, from our community leaders, every chamber of commerce, every municipality, every county government. They got involved because they took the time to understand why we were doing this, and they believed in the vision. It was not an easy road. Trust me, it got bumpy at times. But that's the nature of doing something big. You're going to run into those headwinds, but you have to persevere and work through it. The fact that we're standing here 4 years later, celebrating the success of that regional effort, should be a pretty strong signal about how committed we all are to this thing succeeding. Our health commissioner, Dr. John Dreisner, is here today. You know, John did not ask for this. He was minding his own business, doing his job in Nashville, when all of a sudden this bill pops up, giving him this extraordinary responsibility. They didn't ask, the department did not, and the Attorney General did not ask for the volume of work that this created for them, nor did Marissa Levine up in Virginia or the Attorney General in Virginia. But they took it on. John, I thank you for the time that you took to understand it, to independently evaluate it, the degree with which you took the seriousness of the challenges that came from folks like the FTC and others to try to balance all of those issues. It wasn't easy. Believe me, negotiate, and you drive a hard bargain, by the way. But what we have as a document is as tough as it is. The intention behind the document is to ensure that we succeed in our mission and to ensure that the state can properly protect the public from what could be the negative consequences if we did not stick to that document. So I think we're all committed to this thing succeeding and adapting as we go. So John, you, the Attorney General, and all of the staff at the Department of Health, we owe you a debt of gratitude. Thank you. I can't name everybody, and so if I don't name you here, it's not because we're not important and relevant. It's simply because I had to stop somewhere. But you know, if you look around the room, there's a lot of people in here who either quietly or very publicly got involved in this. Number one, we owe a huge debt of gratitude to our legislative delegation, both in Tennessee and Virginia. The Virginia delegation could not be here today. They're all in Richmond. The Tennessee delegation, many of them are here, including Ron Ramsey, who at the time was the lieutenant governor and was very focused on helping get the legislation passed, and of course Rusty, who carried it, and the rest of the delegation. You guys are great, and we know you're going to be there to have our backs in Nashville, so thank you. The board of Mountain States and Wellmont. Now, I will tell you this. There is nothing harder as a board member than to vote to turn your organization's assets to a new organization and to walk away. Think about that. You know, Mountain States is a $1 billion system. Wellmont, almost $1 billion system. These boards had to make the ultimate sacrifice in terms of their service on the board to say, we're walking away because it's better for the region. If you're on a board of Mountain States or Wellmont, would you please stand up and be recognized? Now, while the governor tried to arrange his schedule to be here today, he couldn't be here, but I want to tell you what he did when he signed the bill creating the pathway for this merger to happen. It's some really great stuff. Now, this is not all going to be milk and honey. This is challenging. Bringing two systems together is tough. Dealing with the challenges, the headwinds in the health system have not gone away. They're going to get worse. They're external. They're everything from cuts to Medicare, things that are happening in the marketplace are very challenging for hospitals. Those aren't going away. And so there are challenges ahead. But there are some very good things that are going to happen. And when Bill Haslam signed that bill, and when John Dreisner signed that document, here's some of the things that they did. Today I can announce that the planning has now commenced to bring a new pediatric trauma center to our region, the only region of Tennessee that does not have one. Planning has now commenced for the development of a residential addiction treatment campus. Planning has now commenced for the development of a pediatric emergency department here in Kingsport and in Bristol. Discussions have now begun between us and other academic institutions, most notably ETSU, to develop a regional education consortium to help guide the planning for our emergence as a center for research and academic advancement. We have formed a population health organization within Ballad Health that will serve as a conduit for targeted improvement in the health of our community. I believe what we spend will be important, but I also think we're going to attract significant outside investment into what we're trying to do as we tell our story nationally. And just this week, Scott Niswonger and I met to talk about strategies for how we can contribute to improve third-grade reading proficiency in our region. So those efforts began simply because the commissioner signed the document. And today I can also let you know that several months ago, the Mountain States Board established a $10 million innovation fund. We chose not to do anything with it because we wanted this to be part of the merger. Because the merger is now moving forward, we'll be establishing a $10 million innovation fund, which will be operationalized under Ballad Health. This innovation fund will be used to invest in emerging technology and health innovation. Great systems like the Cleveland Clinic, Kaiser Permanente, Partners Healthcare in Massachusetts have been doing this, and now we can too. This fund starts small, but it gives us the ability to partner with ETSU and other academic institutions, and importantly with other health systems that have created similar programs to invest in the proliferation of internal entrepreneurship and ideas, of which we have many, and invest in those ideas and external innovation that our patients will be able to benefit from. So these are all benefits that are happening because this merger was done. So, like I said, with the stroke of a pen, the governor and commissioner have set into motion a lot of things that are going to impact Hudson and his generations and generations to follow for years to come. So I'm going to make this commitment to you on behalf of the board. We will make our decisions based on what is best for this region and the people we serve. We will listen, but we will also not wilt from our responsibility to make those tough decisions. Someone has to, and we volunteered to do it. We have a lot of hard work ahead of us as a system and as a community, but I'm absolutely convinced that there's no better group of people than those we've assembled than our team. And I certainly don't think there's a better group of people than the community leaders who have pledged to help us succeed. There are real divisions in our communities. There's a truism, and that's a truism anywhere if you have a region like ours. Parochial differences that have their roots established 100 years ago. But there's something that brings this region together culturally more so than I've seen anywhere else. And that is something that goes back much further than the differences between our local communities. And that common thread is our faith in Scripture. So as you look at our mission statement, our tagline, and our name, know that it is rooted in the one thing that does bring us all together, our faith. The Scriptures are full of God's wish that we serve others before ourselves. It's there everywhere, in the Old Testament and the New Testament. Hebrews 6:10, Galatians, Matthew, Romans. Putting others' needs ahead of our own is not merely a suggestion. God pleads with us to do it. And that's why Ballad Health exists. If you talk to our team members and doctors, I believe that's what you'll hear. Now, I'd like to ask a real hero that a lot of our team members are excited about, and that's Lisa Smithgall, to come up and say a few things. Lisa will be the Chief Nursing Executive for Ballad Health. Lisa.
Thank you, Alan. And this is really an exciting moment, and I'm very happy to be part of it. I've had the privilege of working with nursing leadership positions at both Wellmont and Mountain States Health Alliance. And I can tell you there's no group of people that are more caring and compassionate than the team members that are going to make up Ballad Health. The team member stories that played in the video earlier are a reminder that our health system is full of people who have servants' hearts and a passion for helping others. These stories are everywhere, and as a registered nurse, I've seen them play out in all kinds of ways throughout my career. Alan is right that the relationship between the caregiver and the patient is a sacred trust, and we owe it to our patients to listen and understand their needs. In order for us to do that to the best of our ability, we as leaders, we know that to start listening to our team members is critical to this effort. Right now, we're speaking across the health system at launch events that are in hospitals and clinics, and we're telling our team members about the birth of our health system, and we're celebrating it together. They'll have the opportunity to sign a banner in each location and learn more about the culture we're creating within Ballad Health, as well as share their own stories online and have a little fun at the Ballad Health selfie stations. In a few minutes, you'll have that opportunity as well, and you'll get to see one of the experience rooms next door, what our team members are seeing in their own areas. These launch events are meant to be fun and engaging, but they're also meant to send a message to our team members that their stories are important and that Ballad Health starts with all of them. When patients come to us for care, they're not looking for a pretty building or even an advanced piece of medical equipment. As Alan said earlier, they're looking for someone who will listen to them, someone that they can trust. Our team members earn that trust every day, the way they care for others. I'm excited about what lies ahead for us as we collaborate with local schools to provide new learning opportunities for our nurses and other team members. Nurses in particular are in short supply across our nation. We're going to focus on retaining our nurses with recruiting new nurses and providing opportunities for education and advancement for nurses who want to increase their skill level and excellence in knowledge. I believe that by working together as one system, we will be able to better equip our team members to deliver the best in evidence-based care in every location throughout our region. Now I'd like to invite to the podium David Lester, a member of the Ballad Health Board of Directors and a lead independent director for Ballad Health. David is a pillar of the business community in Southwest Virginia and has been a strong supporter of healthcare in our region for many years. We are happy to have him here today. Please welcome David Lester.
First, I want to apologize for a little bit of sore throat, but I think you've seen as part of the country the most of my life I've lived here, and there are truly special people here. The caregivers that we saw in the video earlier represent the character of our region, and I know those types of stories are playing out all throughout the region, and I can tell you for personal experience in this past year, it has affected our lives and my family's life. And so some of the people that we have to take care of the people in our region are the very best. Prior to my appointment as to the Ballad Health Board, I served on the Wellmont Board and was chairman of the Strategic Options Committee that was formed to evaluate, among other things, potential partnerships. That was a long and stressful process. As Dr. Blackwell, who is here, can attest. But we took that process very seriously. We knew that the future of healthcare in our region, and possibly the state, would be affected by our historic decision. So it was important to us that we act in the very best interest of all of the people that we serve. The private and public debate favored local control, and our board favored local control. And after our team, which includes several physicians, visited some of our could-be potential partners, came back from the area, and it became very clear that the merger from Mountain State was the only option that would give us that ability to retain control. So here we are. The nature of healthcare today makes consolidation necessary to survive. But we just didn't want to survive. We wanted to grow services and provide additional badly needed services in our region that aren't currently available. But we also wanted to retain our region's identity. Excuse me. This merger is an effort to keep our own identity and map out our future as much as possible. As Alan said, there is no group of people better suited to tackle the toughest healthcare issues in our region, because there's no group of people who care more about it than we do. Not only that, but our board, meaning the Ballad Board, is equipped to navigate the challenges that lie ahead of us. As chair, Alan has extensive experience with governance in both private and public sector. And all of our board members have a strong combination of governance experience in corporate and healthcare settings. We have doctors, educators, small business leaders, as well as managers of international companies that bring all kinds of perspectives. And all of us are ready to put our best efforts to work to make Ballad Health a success. And I emphasize, it has to be a success. And with your help, we know it will be successful. Before I close, I want to give special recognition to some of those board members that served on the Ballad, or served on the Wellmont and the Mountain States Board. If they're here today, I'd like for them to stand. Roger Leonard, Barbara Allen, Bob Feathers. I know Dave Crockett could not be here, and Buddy Scott. those who served as board chairs for Wellmont Health System and Mountain States during this historic process. These were extremely difficult and emotional decisions, as you can well imagine. One of the hardest decisions for a board of directors to make is the decision to merge and hand over control to a new board that will carry on the organization to the future. But these individuals had the foresight to know that the best way to keep local control of our health care was to challenge the way that we think about health care in general. Barbara, Roger, if you're here, would you please stand? Bob Feathers, be recognized. Please join me in thanking these men and women for their courage and their service. And I would now like to introduce to you one of our internal medicine physician, Dr. Marta Waite. Please welcome Dr. Waite. I also did heavy editing as Alan does.
Thank you. They told me they needed a real doctor to speak. I don't really know what that means. But good morning. Thank you so much for having me. I wanted to start out by reiterating the Ballad motto, and that is, of course, that it's your story and we're listening. So I took that motto, and that's where my thoughts are coming from today. My first thought was, well, this motto makes sense, right? That's what we do. That's what we're taught in our training. We are actually really instructed to how to assume an open posture, lean in, make good eye contact, try and have a quiet environment, but just engage our patients in that way so that they know we're listening. Sometimes that comes naturally. Sometimes it doesn't come naturally for some healthcare providers, and I'm sure you can tell the difference. But to quote some scripture also, James 1:19 says, "My dear brothers and sisters, take note of this. Everyone should be quick to listen." It says other things too, but that's a good guideline for us. Be quick to listen. Calvin Coolidge says, and I won't paraphrase, but it says, "It takes a great man to be a good listener." Obviously, I'm not a man, but that's okay. And the definition of listen is to give one's attention to a sound. So I took that and I thought, well, okay, good healthcare providers and doctors listen constantly all around them. So first we listen to coworkers. So that comes from our support staff, our clinical staff around us, clerical staff even, because sometimes they know things about the patients that we don't know, that we don't hear. So we have to listen to them so we can provide better care for those patients. We also listen to our fellow colleagues, our specialists, our primary care doctors. We all work together to provide a more cohesive approach to our patient care. And those colleagues can be employed and they can be independent. So everybody has to work together to provide better care. We also listen to the needs of our community, which is why we're here today, right? So we like to make sure that the community has its needs met, that their services are going to be provided for them, that they have the specialists they need, that they have the facilities that they need, and that we have enough primary care doctors to take care of people, even volunteer opportunities out there so patients can get access to care. We also listen to our administrative partners because really they know where healthcare is going. It's changing so quickly. And sometimes we as healthcare providers, we don't keep up with that as well. So we have to use their guidance to know how to maximize patient care delivery. Also, of course, most importantly, we listen to our patients. So we use that not only as a tool to diagnose, but it's also providing sympathy, compassion, love. And in so doing, it promotes healing and it relieves suffering. Helen Keller said, "All the world is full of suffering. It is also full of overcoming." So by listening, we can help our patients overcome suffering, but it takes a team. It takes that whole team collectively to listen, to share, to improve our patients. So I'll close with another Helen Keller statement, and that is, "Alone we can do so little, but together we can do so much." So I will welcome Mr. Levine back.
Thank you, Dr. Wade. In closing, I want to express my sincere thank you to all of you who came today to celebrate. I'm sure that the media has no questions. I'd like to ask you to reach under your seat. There's a gift for each of you under your seat. Inside the bags, hopefully, that are there, are coins that are known as challenge coins. Challenge coins have their history in the military. They have a lot of different meanings, but they're often given to soldiers who participate in a special mission or complete a particularly difficult task. They build camaraderie among the members of a team, and holding a challenge coin signifies an individual's membership and participation in a group that has accomplished something meaningful. One side of the coin is a homage to where we've come from, and one is a promise of where we're heading. Everyone in this room has had a part in making Ballad Health possible, and words can't express how grateful we are for your support. We've started this journey together as a community, and we're going to work together as one region to write the next chapter of our story together. So now, please join us, if you will, in the experience room next door, hear more from our team members and their stories, and share a little bit of your story with us. Thank you for being here today. Please be safe getting home, and God bless each of you. Have a great day.
Our experience room is right next door over here to the right. So please join us in there. For media, we're going to have Alan available for one-on-ones right out that back door there and around the corner to the right.